Hello, my name is Sylvia Neph. I am currently a senior at Alma College, and with the individuals listed on the slide, we work to develop a field-based prediction equation for determining leg limb occlusion pressure. Limb occlusion pressure is the minimum pressure required using a tourniquet or blood pressure cuff that stops the flow of arterial blood into the limb distal to the cuff. Limb occlusion pressure is used in blood flow restriction and ischemic preconditioning. These two occlusion techniques are used in clinical and athletic populations, both as a rehabilitation technique and an ergogenic aid. They create a hypoxic environment to mimic the effects of high-intensity exercise. Blood flow restriction, however, only utilizes a percentage of one's limb occlusion pressure, where ischemic preconditioning uses a pressure that is at or above an individual's limb occlusion pressure. Current measurement techniques for limb occlusion pressure are costly and require sophisticated equipment. So the purpose of this study was to determine whether demographic or other variables can be used to predict limb occlusion pressure. To do this, we had 23 individuals come into our lab for a single session protocol. They ranged in age from 18 to 53. We collected demographic variables at the start of our protocol. These variables were then compared with the limb occlusion pressure found for each individual to see if there was a significant relationship between any of these variables and limb occlusion pressure. These variables included age, height, weight, body mass index, body fat percentage, thigh circumference of both legs, systolic and diastolic blood pressure of both arms using a Welch-Allen automated cuff, mean arterial pressure, resting heart rate, and then single leg wall sit times for both legs. After collecting the demographic information from the patients, they then laid in a supine position on the hospital bed located within our laboratory. The Hokinson cuff, which is this middle image here, was then applied to the individual's non-dominant leg and connected to the Hokinson machine. This machine allowed for us to manually inflate the cuff in a slow and controlled manner, which we did so by increments of 10 millimeters of mercury. We then use the Doppler ultrasound to assess each individual's popliteal artery to see when their occlusion pressure occurred. An image of that screen and one of the subject's popliteal artery can be seen in the image on the right. The Hokinson cuff and ultrasound measurements were then used as criterion measures in the stepwise regression that was used to determine significant predictors of limb occlusion pressure. This table is showing the positive correlation values between the average limb occlusion pressure found between the ultrasound and Hokinson device and compared to the variables that we used. There were two values that showed a correlation as well as potential to be predictors of limb occlusion pressure, those being BMI and mean arterial pressure of the right arm. The first table here gives a model summary using the correlation values found between the limb occlusion pressure and mean arterial pressure of the right arm, which was 0.65. And then the correlation values between mean arterial pressure of the right arm, along with BMI to limb occlusion pressure, with this value being 0.79. Equation coefficients can then be seen on the bottom table, as they were then the values used to formulate the equations that could potentially be used to predict limb occlusion pressure. Those equations that we formulated can be seen here. The first equation takes into account mean arterial pressure of the right arm. The second equation takes into account both mean arterial pressure of the right arm and BMI of an individual to predict limb occlusion pressure. Through this research, we were able to see that our mean arterial pressure and BMI could serve as useful measures of predicting limb occlusion pressure. However, a cross-validation is needed to confirm these preliminary findings, and further analysis should explore what other variables could allow for more accurate prediction of limb occlusion pressure in a field setting. Thank you.